Kia ora. I'm Richard Beasley. I'm a clinician researcher. I'm the founding director of the Medical Research Institute of New Zealand, and my main research interest has been in the field of asthma, which has been a huge problem in New Zealand. We have one of the highest rates of asthma prevalence in the world, and in the 1970s and the 1980s we had two epidemics of asthma mortality. New Zealand had the highest death rate in the world from asthma. Recognising the priority of asthma in New Zealand, I was awarded a HRC clinical training fellowship with Professor Stephen Holgate in Southampton, and during that time it was really a life-changing experience because I really got to appreciate the huge impact and importance of clinical research that was novel and had the potential to change practice. When I came back from Southampton, I teamed up with Julian Crane, Neil Pearce and Carl Burgess, and we formed the Wellington Asthma Research Group. And we did a series of epidemiological studies and clinical studies, and we identified that it was an asthma drug called phenytoral, or Beratec, that was the primary cause of the mortality epidemic. In response to our findings, Helen Clark, who was the Health Minister, instructed the Ministry, or the Department, to withdraw phenytoral from the drug tariff, despite, I might add, considerable pressure from many sources not to do so, from both within New Zealand and internationally. Those regulatory actions led to a greater than 2/3 reduction in asthma mortality rate in New Zealand within a couple of years. But the problem is, most asthma patients do not take their inhaled steroids most of the time. And so this conundrum was really solved with the development of the 2-in-1 inhaler device. And so that every time the patient takes their reliever, they get additional preventer inhaled steroid treatment. And this probably has been the biggest paradigm change in asthma treatment over the last decade or two. So the Medical Research Institute of New Zealand was established over 20 years ago now, and the philosophy was really simple, that the research should be novel, it should challenge dogma, it should have the real potential to increase knowledge and to change practice, to improve outcomes and reduce inequities. And that is the mission that we have that underlies all the work that we do. We have 12 research programs. We're making great advances in all these 12 different fields, and it's been really satisfying to have had the opportunity to train so many emerging researchers, many of whom have gone on to have really important careers and leadership positions, both within New Zealand and internationally.
When I first approached Richard with an idea for conducting a clinical trial, I was someone who had no research track record, and he really approached me as an equal and a collaborator and supported me tremendously. And I think over the sort of 40+ years that he's involved in clinical research, that's something he's done consistently. It's support other people and bring them through and give them opportunities.
In accepting this award, I feel extraordinarily fortunate. I'm fortunate that I've worked with so many highly talented colleagues throughout my career. But most importantly, I've been so fortunate to have had the encouragement and guidance from my wife Susie and from my daughters Anna and Georgina. They have supported me and guided me every step of the way, and with unconditional support. And they have shared in my dream and allowed me to live my dream. Ngā mihi nui.